What's up guys, back again for another video. And yes, I am in the medical library being studious. It is now a little after 1 o'clock in the morning. And yes, I am once again on call. So while I'm here making sure that the rest of you are safe, I had a thought come into my mind. And it's something that, if you're in medicine or thinking about going into medicine, you're going to hear this quite often. I've heard it throughout the duration of my studies. I still hear it now during my career. And I oftentimes do mentor students or prospective students about medicine. And this is by far the number one thing I always hear from them. And it's that, I might not want to go into medicine because I feel like it takes too long. They feel like the process just takes too long for them, and that's something that turns them off from becoming doctors. And sometimes when they say this to me, I wonder, I feel like in their minds, they think of a doctor as this character over here behind me. They feel like by the time they actually become doctors, that they're probably going to look like him. And I'm here to tell you, that's not the right perspective. And this is what I tell usually students that ask me this question. That's really not the right perspective to think about medicine. Number one, yes, medicine takes time. That's universal. No matter which country you go to, and no matter where you practice medicine, medicine takes time. And the reason why medicine takes time is because the nature of your work as a physician, as a doctor, has major implications. Not only to the patient, which is our primary focus and objective, but even to what that patient means to other people in their life. That person may be the breadwinner of the home and has a wife and kids that depend on him. That person may be an important figure and she might be the glue that holds her community together. So the decisions that you make impact your patient and also everyone that's dependent on your patient. All their loved ones, all their friends, all their family. So that's pretty large responsibility. That's a big responsibility to put on your shoulder. And the only way to make sure that you can handle that responsibility properly, to make sure that you can make the right decisions and be clear-headed when things get tough, it takes time. You can't expect someone to go into 4 years of undergrad and then open up the books and study a little bit of medicine and then trust them to take care of your loved ones. And that's the thing, when you flip the question back and you say, would you want a doctor who did 4 years of undergrad and maybe studied medicine for a year and didn't have to do any residency? Would you want a doctor like that taking care of your loved ones? And I'll tell you, majority of people will say, no, I don't want a doctor like that. But then when it comes time for you to put in the work, you're not ready to put in that work. Now, the second thing is, as a physician, you have to be okay with delayed gratification. Yes, you have to go through a very vigorous training process. And then after that, you're going to have to go into postgraduate training, which is residency. And that could last from anywhere between 3 to 7 years. And then you'll start making the money of an attending physician and you'll be practicing as an attending physician and you'll have more freedom with your time. But while you're in this process of residency, training, studying, you have less freedom. And that's what scares people and turns people off. But as a physician, you have to be prepared mentally. And this is something you should remember. If you're going into medicine, you have to remember this. You have to be okay with delayed gratification. You will get the gratification that everyone else gets when they have nice salaries and they buy nice things and they go on nice vacations. You will have that too, but you'll have to wait. You'll have to earn it later. And the price of that is that you get to do things that no one else gets to do. You have the privilege to do things that nobody else gets to do. And then also, you have to remember that if you are really not into this idea of delayed gratification, there's different types of physicians. You can become an internal medicine doctor where you treat patients with medical management, and oftentimes that medical management takes time. So you'll come up with the best plan that you think is for the patient. You'll have them start the treatment, and they might need 3-4 doses before a difference gets made. So you have delayed gratification when you're treating your patients. On the contrary, you can go into something like interventional radiology or surgery, where you have instant gratification. Patients come to you in a very severely sick state, and when you do the procedure, you instantly have the privilege and luxury of watching them get better. So once you go into medicine, there's different fields and different specialties that you can go into depending on the type of gratification that makes you feel fulfilled in your life. But you have to remember, regardless of what you do, you have to be okay with delayed gratification. So it's not about the amount of time. It's about how that time is going to be spent. And that's something that my mother used to say oftentimes, and it's a lesson that I learned from my mother, and she still says it till this day. She says that, yeah, you can complain about the time that it's going to take you to do something, but if you were to not do that thing, that time is going to go regardless. Time is finite. Time is a resource. So you could go into a different field and the same amount of time is going to pass. Either you are okay with the other field and you feel rewarded doing that type of work, or you know yourself and you will feel more fulfilled with your life knowing that you get to do things and have the privilege to interact with patients, maybe do surgeries and do procedures on them, manipulate their anatomy, and you have the privilege to gain access to other people's bodies. And that's not something that most people get to say. My day-to-day is oftentimes so different, and some of the stuff that I get to do is not ordinary things that people do when they go to work. So you have to really put in your mind, what is it that you value? What is it that's going to make you feel rewarded and fulfilled for the rest of your life? And this time argument, really remember, it's not like you're going to become a doctor and you're going to spend more time and waste all of your time. The time is, nobody can change that. The time is there. Either you're going to use it to become a doctor, or that same amount of time is going to pass and you're going to do something else. You're not going to have more time just because you decided not to become a doctor. So remember that. Let me know what your thoughts are down below. Don't forget to like and subscribe. I have a lot of videos that talk about medicine and training and just random insights that I've picked up. So I'd appreciate the comment, and let's hope that the rest of the night goes well for me. So let me know what you think down below, and until next time.